over the years, what I've seen is that nursing has become a less desirable profession. When I began, nurses were expected to just endure these working conditions. You know, everybody had the Florence Nightingale syndrome where, hey, we're here to serve and it doesn't matter. But, you know, we need to take care of our caregivers. Because over the years, what I've seen is that nursing has become a less desirable profession. Some of the people in safe patient handling have become very concerned when they look at the number of nurses who want to leave. You know, a number of nurses, because of what they're called on to do, want to leave, and then some have to leave. They don't have any choice. There are so many nurses that I've seen suffer disabling back injuries. And when I say disabling, that disability is with them for life. You know, if someone has a back injury or a musculoskeletal disorder, they're more likely to have a recurrence. But during COVID, we saw attention being directed to those caregivers, because talk about superhumans. What these caregivers did during COVID was really super. And we began looking at some of these stories of these nurses, and we realized what these people were doing. And a number of people said, you know, we got to take care of these people. Today, as we look at the needs for the future with an aging population, we're going to need a lot more caregivers. And if it's a less attractive profession, we need to do something that's going to want to get people to want to do these jobs. So I'm hoping that feeling is going to be sustained. Looking at other jobs, I've been in ergonomics. I look at other industries. The task of lifting something over 35 or 50 pounds in another industry, that's not acceptable. Okay, we design all kinds of equipment in ergonomics. We see all these robotic devices or lifting devices. There are so many devices that have been developed in other industries to do the task of lifting because it has been considered to be unacceptable. But in healthcare, you know, we feel we got to be hands-on with the patient. We feel, you know, this whole idea of manual lifting, it's going to take a while for us to move beyond that and realize that the loads involved, okay, the loads involved of lifting a person are unacceptable and, again, beyond the capability of the workforce.